Hi guys, in this video I'm gonna focus on the muscles that are connecting the scapula to the humerus. In my previous video I showed you the muscles that are connecting the exoskeleton to the scapula that are called the exoscapular. Now I'm gonna focus on the muscles that are referred as the scapulohumeral, connecting the scapula to the humerus. So we have 6 scapulohumeral muscles. 2 of them a little bit large and 4 of them are so small and deep and local muscles. So in this upper limb model, I'm going to show you the largest one, which is really global and large muscle here in the upper lateral side of the arm. So if you look at me, here I have a muscle which is on the upper lateral side of the arm. It's connecting the scapula and clavicle to the humerus. So look at here, this muscle, this one, it is called the deltoid. So deltoid at the top, it attaches to the clavicle. This is the clavicle, and laterally it attaches to the acromion process of the scapula, and posteriorly it attaches to the spine of scapula. So it has a U-shaped attachment site. I'm going to show you on the model here. So if you look at here, this is the shoulder joint from the anterior view. From the superior view, you can see the humerus. At the top anteriorly we have the clavicle, and posteriorly you can see the scapula. So the deltoid attaches here, so like this. It has a U-shaped attachment site. It attaches to the lateral 1/3 of the clavicle, the acromion process of the scapula, and the spine of scapula. So like this, the U-shaped attachment site. And then muscle fibers converging together, and it attaches to the midpoint of the lateral surface of the shaft of the humerus. There is a rough area here, it's known as the deltoid tuberosity. So here is the deltoid. So deltoid attaches to the deltoid tuberosity on the lateral surface of the shaft of the humerus here. So if you look at here, this rough surface is deltoid tuberosity on the lateral surface of the shaft of the humerus. So we have 3 types of muscle fibers for the deltoid. Anterior muscle fibers that are connecting the clavicle to the humerus, middle muscle fibers connecting the acromion process of the scapula to the humerus, and posterior muscle fibers connecting the spine of scapula to the humerus. So anterior, middle, posterior, or clavicular, acromial, and spinal muscle fibers, 3 different muscle fibers. What is the action of the deltoid? Actually, deltoid mainly can do abduction. So it makes more sense because it attaches to the lateral surface of the shaft of the humerus. When it contracts, it can do abduction like this. Can do abduction. So the primary action is the abduction. But if you look at specifically to the muscle fibers, so anterior muscle fibers, as they are crossing the shoulder joint anteriorly, they can also do flexion. This is the flexion. This is the flexion of the shoulder joint. And they can also do a little bit medial rotation. This is the medial rotation. During the medial rotation, anterior surface of the arm faces medially. The other name is the internal rotation. So this is the anterior surface of the arm, and here we have the anterior muscle fibers, and when they contract, they can do flexion and medial rotation. What about the posterior muscle fibers? As they're crossing the shoulder joint posteriorly, they can do extension and also can do lateral rotation. So when you're doing abduction, actually the anterior and posterior muscle fibers, they are cancel out each other. So this one doing action, flexion and medial rotation, posterior do extension lateral. They are cancelling out the unwanted movement, so they can join the middle fibers to do abduction. So all muscle fibers can do abduction. When you are doing abduction, the anterior and posterior muscle fibers, they are synergistically working together, cancel out the unwanted movements and joining to the middle fibers to do abduction. So it's a strong abductor. But the medial fiber specifically can only do abduction because it is just crossing the shoulder joint laterally. So I talked a lot about the deltoid. The second axiohumeral muscle would be this one. From the posterior view, you can see this muscle. It's called Teres Major. So the word teres means a rounded shape. If you take a cross section through the Teres Major, it has a rounded muscle fibers. So it's the Teres Major. It's connecting the inferior part of the lateral border of the scapula. This is the lateral border to the humerus. So I can show you on the bone. So look at here. Actually, it's coming from here, the lateral border, inferior part of the lateral border of the scapula, and it goes forward, attaches here. Humerus, lesser tubercle, just down here, we have the crest of the lesser tubercle, crest of lesser tubercle, greater tubercle, crest of greater tubercle. So it attaches here, the crest of the lesser tubercle. Look at my finger. If you look at my finger, it's coming from here, going up and attaches to the here, to the lesser tubercle crest. So what would be the action? So action would be the adduction. It can do adduction. Opposite to the deltoid, it can do abduction. Teres Minor, in contrast, do adduction because it attaches here. It can also pulling the arm back. It's known as the extension. And it can also do medial rotation, or internal rotation, because it attaches to the anterior medial side of the humerus, can do medial rotation. So adduction, medial rotation, and as it's coming from the posterior view of the shoulder, you can do extension. 3 actions for the Teres Major. So these are 2 large global muscles. I'm going to show you 4 small local muscles that are known as the rotator cuff muscles. So rotator cuff muscles, they act like a cuff. It's covering the shoulder joint. So you see here we have the shoulder joint. So they are covering the shoulder joints from the superior view, posterior view, and anterior view. And they do rotation, internal and external rotation of the shoulder. That's why it is referred as the rotator cuff muscles. So rotator cuff muscles, they are small local muscles. We have Supraspinatus, Infraspinatus, Teres Minor. This is the Infraspinatus. Down here we have this small Teres Minor. And you can see the supraspinatus coming from the supraspinous fossa. I can show you on the bone. So this is the scapula from the posterior view. Supraspinatus attaches to the supraspinous fossa of the scapula. This is the spine. Above the spine we have supraspinous fossa. Infraspinatus attaching to the infraspinous fossa. Teres Minor coming from the lateral border, just above the Teres Major we have Teres Minor. So all these 3 muscles covering the shoulder joint from the superior and posterior view, and they attach to the greater tubercle of the humerus. Greater tubercle of the humerus. So I can show you again. This is the greater tubercle. Supraspinatus attached to the top of the greater tubercle. Infraspinatus to the posterior of the greater tubercle. Teres Minor again below the infraspinatus and posterior view of the greater tubercle. And the last rotator cuff muscle is coming from the anterior view of the scapula. It's called Subscapularis. It covers it attaches to the subscapular fossa. So this is the anterior view of the scapula. Here we have a depression. Look at here. This depression is known as the subscapular fossa. So subscapularis attaches here, and the muscle fibers converging together and attaching to the lesser tubercle. So supraspinatus, infraspinatus, teres minor, they attach to the greater tubercle. Subscapularis attached to the lesser tubercle. So just there is a mnemonic to help you to remember the muscle attachments. It's called SITS. S at the beginning of the sit refers to the supraspinatus. I, infraspinatus. T, SIT, sit, teres minor. The last S of the sits refers to the subscapularis. Supraspinatus, infraspinatus, teres minor, and subscapularis. If you put your fingers here, so it looks like this. So 3 fingers shows the 3 muscles: supraspinatus, infraspinatus, teres minor. They attach to the greater scapula. The sit of the sits attach to the greater scapula, and the thumb shows the subscapularis attachment to teres minor. So what is the action of the rotator cuff muscles? As its name tells us, it can do rotation. Supraspinatus, infraspinatus, and teres minor, as they are attaching to the shoulder, the greater tubercle, and covering the shoulder joint posteriorly, they can pull or rotate the shoulder laterally. So they can do lateral rotation like this, lateral rotation. And as the subscapular is covering the shoulder joint anteriorly and attaches to the teres, the lesser tubercle, they can pull the scapula medially. It's a medial rotation. Subscapularis medial rotation. The rest of them do lateral rotation. And they also, as you know, they also stabilize the shoulder joint. What's the meaning of stabilize? Actually, they're covering the shoulder joint, and when you are doing a big job, for example, when you are carrying the heavy object, these small local rotator cuff muscles, they will stabilize your shoulder joint, hold your shoulder joint, and allow the other large global muscle to do the action efficiently. That's meaning of the stabilizing the shoulder joint. And when I'm explaining to my students about the stabilizing, I give an example. For example, if a person who is changing the light, so you can put the sit and hold the sit, and the other person goes up to the sit and changing the light. So when you are holding the sit, you are acting like the rotator cuff muscles. So you are stabilizing the sit to allow this person who is changing the light. So that person would be the large global muscle. Okay? So it means the stabilizing the shoulder joint. So these are the 6, I showed you the 6 scapulohumeral muscles. I showed you the deltoid. The first one would be the deltoid. The second one is the teres major, and the 4 rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and anteriorly we have subscapularis. So we have deltoid, teres major, and 4 rotator cuff muscles. They are totally known as the scapulohumeral muscles. Thank you so much for your attention. In next video, I'm going to show you the axiohumeral muscles. We have 2 axiohumeral muscles. Okay.